Now at 5:30, topping the news, MIS-C. That's the name for the rare, potentially deadly syndrome in children that's been linked to the coronavirus. And the city's health department has found 147 cases of kids suffering from it. Government Affairs reporter Melissa Russo, who first reported on MIS-C, has an exclusive look now inside a pediatric ICU where they're treating children for this. She's live in Murray Hill with the latest. Melissa.
Yeah, Adam, before this new syndrome had a name, the very first case we heard about was at NYU Langone Hospital, not far from here. Then we heard about more cases at Mount Sinai, then Montefiore, then Cohen Children's Hospital, and so on. Now the state is tracking these cases, and we're at 137 and counting. Making the rounds today.
Feeling good? Awesome. Let's see your hands. Remember they were red when you first came in. See that one? Good. The color looks much better.
Dr. James Schneider runs the ICU at Cohen Children's Hospital in Nassau County.
You feel your pulse? All right, this tells us how well your heart's beating. And how
this 15-year-old is recovering from what the CDC is now calling multi-system inflammatory syndrome in children.
I just want to feel the belly if I can. All right? Tell me if you have any pain anymore. No pain? Awesome.
It's really what I call good old-fashioned critical care, where kids need blood pressure support or breathing support. They're coming in shock to the intensive care unit.
Dr. Schneider says his hospital has treated more children than any hospital in the state. 43 children, almost all of them presenting with a persistent fever and abdominal pain, diarrhea or vomiting. Some also develop a rash, red eyes, lips or tongue, swollen hands or feet, and an enlarged gland on one side of the neck.
The bottom line is it is so important to just get the message out.
It was the News 4 I-Team in late April that first brought the existence of this mysterious children's illness to the attention of both the city and Governor Cuomo's state health department, asking about it repeatedly.
Melissa, Jim, do you know?
I know that this is something that Dr. Zucker has been looking into, and Melissa has been sharing her reporting with me directly, and we'll have something on that tomorrow.
More than a week passed before the state surveyed its hospitals, but today it appeared Governor Cuomo was taking the credit.
I believe we discovered it. We've given the nation and the world a heads up.
The state is now reporting 137 cases, the city 147. Why the inconsistency? The city is counting cases with a suspected link to COVID-19, while the state is only counting cases with a confirmed link, meaning a positive test result.
I think that's the tip of the iceberg, and I think there's a whole iceberg under that tip. I'm not a doctor, but that's what I think.
The governor thinks we haven't seen the worst of this syndrome yet, but Dr. Schneider is a bit more optimistic.
Surge of what we're calling MIS-C patients seems to be at least on the downswing. It's encouraging that hopefully things will continue to slowly get better.
And Dr. Schneider told me today that he's personally very concerned that he sees too many people out and about, not social distancing, not wearing masks. He's afraid there will be another spike in primary COVID infections, only to be followed by another wave of this delayed immune response in children, which makes them very, very sick. We're live in Murray Hill. Melissa Russo, News 4 New York.